Good afternoon, everybody. I'm Deputy Commissioner Elizabeth Walters from the New York State Department of Ag and Markets, and I will be moderating this webinar today. Thank you all for joining us on this very timely webinar on heat exposure and related illnesses. We are all certainly mindful of the temperatures this summer, including today. It's quite hot here in Albany, so we are certainly mindful of the temperatures this summer. And we know farmers often make precautions on days such as today to avoid high temperature and sun times. However, the more we discuss and know about the risks of heat exposure and related illnesses, the more we can take additional mitigation techniques and be able to see the signs of heat-related illness and ensure that employees are able to get resources and stay safe and healthy. A few housekeeping items before we begin. Upon entering, each of you have been muted, and you will be muted during this just to keep distractions down, as we are recording this for folks to listen to later on. Should you have any questions during the webinar today, please enter it into the chat feature of WebEx, and we will get to them at the end of the presentation period. Feel free to put them in as we go along, and we'll just pick them up at the end during the question time. Like I said, this webinar is being recorded for a later date and will be shared, and we can get going. So we are so fortunate to have such a well-versed people here in the state of New York on occupational safety and health topics such as heat exposure. And many of these folks should be no stranger to you on this call. But I will introduce each speaker as we transition in between each of the presentations. So now let's begin. We are first joined by Nick Donofrio. He works for the Occupational Safety Health Administration, OSHA, in the Buffalo area office since 2005. As a compliance assistance specialist for OSHA in Region 2, he conducts outreach, education, training, and relationship building to fulfill one of OSHA's primary goals, compliance assistance. He's a graduate of Fairmont University and received his his master's degree in occupational safety and health management from Marshall University in Huntington, West Virginia. Nick, I'll turn it over to you.
Thank you. Can you see my slides?
Not yet.
Not yet. Okay. Let's try that again. Share. Let's try this again. Share. Oops. Application. Oh boy, I'm sharing that. Stop sharing. It worked yesterday. Oh boy. Application. I have it open. You can't see it, huh?
No, not yet.
Oh boy. Okay, let me see, window.
Nick, do you want us to put it up on our screen?
Sure, if you can do that, absolutely.
Tim, do you happen to have that, or you want me to grab it?
Well, I do have it, Nick, but it looks like what I have is actually PDF and not your full presentation. What is, could you tell me what it's called?
It's the, should be the 8/1/24 webinar. Prevent heat illness.
Yeah, well, what I was given is a PDF and not a presentation.
I think you can run through it with the PDF.
Then we will do it. Yeah, just one
Give it a
slide
shot.
then.
Thank you.
Okay, great. So thank you, Elizabeth. I apologize for the technical difficulties. Like I said, it worked yesterday, but this is live. So and thank you, Elizabeth, and everyone for the opportunity to speak at today's webinar. So next slide, please. Whoops. So next slide, yeah. Before we get started, I would like to take care of my legal obligations by reviewing the disclaimer. So basically, the information I'm providing today is a tool to provide clarity on certain topics and expected legal requirements. So my talk is not meant to be an exhaustive discussion, but rather information for you to be apprised of recent developments and resources that OSHA has available and is making available. And additional information can be found on our website at osha.gov, or I'll put my email address in the chat and you can reach out to me directly there. Okay, next slide. So before I get started, I'd like to address the public perception of OSHA's mission and image. Certainly the enforcement part is very well known to the public. However, we do offer other services to complete our mission of providing a safe and healthy workplace, regardless of immigration status, to all employees. So we do that through enforcement, as I said. We also do outreach and compliance assistance, and that's what I'm involved in today. We also support, particularly in New York State, the New York State Department of Labor and its efforts to offer OSHA or consultation services. This is primarily targeted to small employers, less than 250. That size employer typically may not have the resources to have a full-time safety person. So each state offers a free and confidential safety service, consultation service, where they will come out to your site, conduct a safety assessment, and help you put together a safety program. So next slide, please. So why are we here today? Why are we talking about heat? Well, heat is a leading cause of death among work-related events. According to the Bureau of Labor Statistics, annually about 40 persons die on the job due to heat exposure. That also translates to about 3,500 injuries and illnesses annually. 80% of those heat-related fatalities occur in outdoor environments. However, we believe these numbers may be underreported or underestimated because many of the symptoms associated with heat exposure overlap with more common diagnoses. So when we think of heat exposure, we think of Texas, California, Florida, but in the Northeast and in New York State, we may not be accustomed to heat, although we have been having some heat this summer. Case in point, in 2020, of July of 2020, in Geneseo, New York, which is an upstate, a 35-year-old construction worker working on a bridge project, he was performing light duty, sorting bolts. He died on the job at his second day of work due to heat exposure. His story can be found on YouTube. If you look for Remembering Tim, the video, his parents describe those days leading up to his unfortunate on-the-job fatality due to heat. And we also know that agricultural workers are estimated to be 20 times more likely to suffer from heat-related fatalities. Next slide, please. So what has OSHA been doing? Well, we've been on this topic of heat exposure for a number of years, beginning in 2011. At that point, we began a campaign of water, rest, and shade. Next slide, please. And then in April of 2022, we created a national enforcement program for OSHA inspectors to proactively inspect workplaces for heat-related hazards. We call this the National Emphasis Program on Outdoor and Indoor Heat Hazards. Next slide, please. So what is a national heat emphasis program? Well, it encourages employers to protect workers from heat, and we go out and assess the employer's abilities and capabilities to do that. As I said, we've done about 5,000 heat-related inspections since 2022. We're looking for that, providing water, rest, and shade. Do they train employees? Do they train their supervisors on the signs and symptoms of heat exposure? And then we're also looking, do employers have an acclimatization program? Acclimatization is the process where the body begins to become accustomed to heat, but it's a gradual process that needs to take place over time, particularly for new employees or those returning from work after an extended absence. So this national emphasis program included both enforcement and compliance assistance and outreach. Next slide, please. So one of the things that the National Emphasis Program did is it established these heat priority days, and we chose 80 degrees F, which is an accepted level, kind of I call a trigger point for when employers need to take action, when heat becomes a hazard. And it's the heat index, right? It's not the heat, it's the humidity. So the 80 degrees F is actually a heat index, right? And when it reaches that point, under the National Emphasis Program, we will initiate compliance assistance to high-risk industries. And when it's a heat warning or heat advisory issued by the National Weather Service, then we will go out and conduct inspections related to the National Emphasis Program. Next slide, please. So most recently, on July 2nd, we issued a draft proposal for a heat injury and illness prevention regulation. Now, this has been in the works for a couple of years. This has been on the same track as the National Emphasis Program. And so next slide, please. So this is a proposed for a regulation specifically because currently no regulation exists within OSHA to regulate occupational exposure to heat in the workplace. So the standard would cover general industry, construction, maritime, and you can see also the agricultural section. There are also some exclusions. If you're working indoors and the heat is below, the temperature is below 80 degrees, it would not apply to emergency responders, telework, sedentary work, and so on. Next slide, please. So what does the proposed draft regulation require? Well, it's going to require all employers to have a heat illness prevention program. And what is that program going to contain? The employer needs to designate a person, a heat safety coordinator, to monitor and implement this heat illness prevention program. While this program is being drafted and brought into existence, the employer needs to consult with employees and get their input. This program it's a living document. It needs to be reviewed annually. And if you have more than 10 employees, it needs to be in writing. It also needs to be in a language that employees can understand and comprehend. Next slide, please. So it covers outdoor work. So for outdoor work, the employer would be required to either rely on the local heat index forecast, or use a wet bulb globe temperature device, a device that takes in humidity, temperature, wind speed, and other factors. And then for indoor work, the employer would be required to do basically a hazard assessment to determine whether heat is a hazard in the workplace. Next slide, please. So it proposes 2 heat triggers. So you see that 80 degree F that was mentioned in the National Emphasis Program. We call that the initial heat trigger. You can also use a wet bulb globe temperature a limit. And it also provides for a high heat trigger, which we set at 90 degrees heat index. Next slide, please. So next slide. So when that initial heat index trigger, that 80 degrees heat index is reached, the employer needs to do certain things. Provide drinking water up to 1 quart per employee per hour. It's recommended that employees drink between 8 and 12 ounces of water every 15 minutes. Their employer would be required to have an outdoor break area. Remember, water, rest, shade. Rest breaks if needed, those need to be paid, and then maintaining communication with employees during that initial heat trigger, that 80 degree heat index. Next slide, please. And when the temperature reaches that high heat index, the heat index of 90 degrees or higher, additional requirements kick in. A minimum 15-minute rest break every 2 hours, paid. observation of employees working in that high heat trigger environment, and use of a buddy system. One of the first signs and symptoms of heat illness, heat stress, is mental confusion. So it's important to buddy up with someone during these high heat trigger events, so that you can check on each other's level of consciousness, and take action when those first signs of mental confusion are recognized. Also, um, the supervisor needs to check on employees every couple of hours, and then specific hazard alerts, reminders about the hazards of working in these high heat environments. Next slide, please. So I know Richard is going to mention this. There's also a NICAMH OSHA app that you can have on your phone that we recognize, or that we recommend that people take advantage of. This is a free app, and I know Rich is going to mention this. So I'll put my email in the chat. If you have any questions, please reach out to me. Thank you.
Thank you so much, Nick, for that information. Next, we're going to Dr. Richard Stup. Dr. Stup provides leadership for educational programs and applied research in the field of agricultural workforce and development at Cornell University. Major program areas include leadership development, human resource management, labor law compliance, and organizational development. Prior to his work at Cornell, he worked with both Farm Credit and Penn State. He earned his doctorate from Penn State in the field of workforce education and development. Turning it over to you, Rich. Thank you.
All right, thanks, Elizabeth, and good afternoon, everyone. So I wanted to focus a little bit on the leadership and management aspects of heat safety, because we know that it's we can learn the science and we can learn what the best practices are, but what really matters is what happens day to day in the workplace. And like Peter Drucker said long ago, it's become kind of a management axiom: what gets measured gets managed. And so I just wanted to reinforce a couple of thoughts, and Nick shared a few there, but about getting the stuff into place so that day to day it's happening in the workplace. So with that idea of measuring, hey, it's hot and it seems to be getting hotter. And no matter what you feel about global warming or climate change and that sort of stuff, we can measure the temperature, and that's what that is, the global departure from a historic average. It's hot, and we're all noticing that for sure. That's a good measurable, and so we can predict pretty comfortably that it's going to be hot in future years as well. So with that in mind, we need to be doing things to measure what's happening on our farms, what's happening with our employees, and then manage that so that people are safe and that they're most productive and happy in their work. So let's do that. Let's start measuring and managing for heat. And Nick shared the app that's available from OSHA and NICAMH, and you can get it from the Apple Store and Google Play, whatever. I've got it on my phone right now. And basically, wherever you are, you can pull that app out and take a measurement of that heat index right there, right then. And I'm suggesting that we need to be starting to measure that. We need to be having our supervisors starting to record that information on a regular basis, at least once a day right now, but probably more than once a day, definitely more than once a day when it's high temperatures out there. So we need to be tracking this over time. And another key point here, build heat safety into your normal management practices. And that's my theme here for the next few minutes. Nick mentioned those new workers, people that have not acclimated just yet. Those are the ones we really need to focus on. And so they're most vulnerable, and the deaths occur there, and most likely heat illnesses will come there as well. So build heat safety right into your onboarding. Those of you that are seasonal, they're going to have people, especially during the hot summer months. It's got to be part of your onboarding so that right away they know what the heat issues are, not just how to recognize heat illness, but what to do. We'll talk more about that later. You know, what are the actions that we take? What are the prevention measures that we take? What are the emergency measures that we might take? So build that into your onboarding, and of course, train employees to recognize heat illness and what to do. OSHA has a fantastic curriculum built already. It's very practical. Provided a link there to it, but that OSHA heat illness prevention training plan. Again, it's very practical. You can print it out. You can use it at any work site, because you can show some full page illustrations, and then you can go along with that. And they've got it set up so that it's 45 minutes in total, or you can do it in 15-minute chunks. Very practical for part of your orientation and for supervisors to be working with the employees in practice at your farm. I've mentioned supervisors a couple of times. Like so many other things, it's, many of the folks that are on the call right now are the owners and more senior managers in the businesses, but it's the supervisors that make things happen day to day. It's the supervisors that'll be there in the field, in the workplace, that are going to see that employee that's in distress, or they're going to make sure that the breaks are being taken or that the equipment is in place in order to provide first aid. So make sure that the supervisors know that there's an expectation as part of their job that they be aware of heat illness, that they be monitoring the employees, looking for that slurred speech and other signs, and that they know what to do. So the signs of heat illness, what to do in terms of first aid for those employees to head it off before it becomes a big problem, or when they do have a big problem, if it happens in that way, how do they call for help? We know we've got some supervisors that, English is a second language. It might be difficult for them to call 911. What is the plan if they need to call for help in an emergency? We need to be training people on all those specifics, walking them through that to make sure that they understand. OSHA shares also, this is part of some of that training. This is, some of the first aid for heat illness. And you see here, we've got a tub in that image where a person is in water and ice in order to cool someone down rapidly. And you've got a tent or a cover there below with a fan and water and things like that. That's all great stuff. And that's all the stuff you need to be ready to use in the event of heat illness or an emergency. But you got to make sure, from an ownership and leadership standpoint, we got to make sure that that stuff is there and that it's available. So there are portable shade cloths and shade tents. I put a couple of prices up there on those things. The cold packs, they need to be available. You got to have a cooler with some ice, maybe some cold packs and a fan. That tub could be available. It could be on a truck or a piece of equipment there, but and the ice and a cooler chest and things like that. You're going to have to train your supervisors and your crews to work on this every day, make sure they have that gear just in case of emergency, and that they know where it is and how to use it in the event of emergency. It's a terrible shame if, they might know how to deal with the situation, but don't have the equipment to do so. So, leadership's got to make sure that that equipment is in place and accessible. Just a quick reminder, of course, those that are seasonal, the OSHA field sanitation standard is, of course, in place. You need to provide fresh water in individual cups, and be mindful that even if workers are bringing their own water bottles, you still have to provide water for the whole crew. That's still part of the requirement. Of course, toilet and hand washing facilities. I shared an image here. I had the opportunity to go to California and see what they were doing a couple of years ago. And so they had portable stations like this. I'm not sure if you can see it well, but in the back of behind the porta potties, that's a shade structure. It's not up right now, but they can easily flip that up and open up the curtains, and they've got storage for all the workers' gear and things like that. So we can put this together, build it into our systems, build it into our management, and make sure it's there. So let me wrap up there. You got to train those crews, make it part of onboarding. Emphasize to the supervisor that this is what part of their job, part of their responsibility. Get the facilities and equipment in place and make it part of your management structure and your culture. Thanks so much.
Thanks so much, Rich. It is such a cultural aspect and that with all safety items. So next we are turning it over to Dr. Brian Quinn. He is the New York Center for Agriculture, Medicine and Health Medical Director and oversees the Health Work Occupational Health Division. He splits his time between caring for workers and involvement with NYCAMH's various research efforts. He attended medical school at Columbia University's College of Physicians and Surgeons and holds an MPH from Harvard University's School of Public Health. Dr. Quinn?
Oh, you can hear me now? Okay. And is my screen showing?
It looks good.
Okay. All right, thank you. So yes, thank you for the introduction. And pleasure to be here. Trying to figure out how to work this darn thing. Oh, here we go. So it's my task today to talk about the clinical aspects of heat illness. And I think to start off, it's useful to know some of the normal physiology of what happens when the body is exposed to heat. You can see the external heat from the sun or the ambient air, especially in combination with doing work or exercise, results in an increase in temperature. Now, the body's very good at keeping the temperature, 98.6 plus or minus a degree or so. But when it registers that it's going up, this is the normal response. The heart starts to beat faster. It sends blood to the periphery, to the skin. And the point of that is it wants to allow the heat to escape into the external world. So skin, certainly if it's showing, is going to be more effective than if it's covered with heavy clothing, for instance. And the heat escapes by various mechanisms, but the most effective one is actually sweating, where it evaporates off your skin. And to have this whole thing work, you need a intact cardiovascular system, and your sweating system needs to be functioning. If you're really dehydrated, for instance, you may not be able to provide a lot of sweat. So there's a few categories of heat illness that I'm going to discuss. Heat cramps and heat syncope are not as serious. And of note is the body temperature is not elevated typically in those cases. Heat exhaustion and heat stroke are the more serious ones. They're the ones that we worry about. And in those cases, body temperature is elevated. CDC has a fact sheet that can be useful. They also talk about sunburn and heat rash, which I'm not going to talk about, and mention heat syncope, but this is a useful fact sheet. So heat cramps, this is something that you may have experienced yourself. Basically, a painful involuntary contractions of muscle. If you're exercising or if you're working, the muscle that's being utilized is the one that tends to cramp up. And the best thing that can be done at that point is, well, first of all, it can be very, very painful. And sometimes you have to stop whatever you're doing. Sometimes I've seen people fall to the ground if their leg cramps up. And treatment is really pretty simple. Stretching out the muscle, massaging the muscle, and also hydration. Dehydration seems to make this occur much more frequently. So hydrating this person with water, and preferably with water and some electrolyte solution. Again, core temperature is not elevated. So heat syncope, you may have been experienced something where you're at a ceremony or something where people are standing for a long period of time and somebody faints. Well, that's typically heat syncope. As I mentioned before, when the normal response to heat is the cardiovascular system sends a lot of the blood to the periphery. And if you happen to be dehydrated or if you have some underlying medical condition, it's going to result in a lower blood pressure because all the blood is out in toward the skin. And you may not be able to to respond normally if you, as I said, if you're dehydrated. And what happens is a fainting episode. This is not a serious condition. This guy, could get hurt. That's the only thing. You got to make sure they didn't get hurt. But the treatment is really quite simple. put this person into a cooler area, have them drink some fluids, and they're usually feeling pretty good pretty quickly. Rehydration is a good idea if you're prone to this kind of thing. So heat exhaustion, this is where it gets a little more serious. You see a lot of heat exhaustion in endurance athletes and stuff like that. But this is also something that workers definitely will experience. It's a spectrum of illness. It can be, mild to severe. As it gets more into the severe range, it can almost become like heat stroke, but there are some important differences. But the symptoms generally will include some of these things: heavy sweating, extreme weakness, fatigue, thirst, headache, nausea, dizziness, and muscle aches. Now, importantly, there are no neurologic signs. There's no confusion. There's no slurred speech, seizures, coma. These things do not occur in heat exhaustion. This person would be able to tell you, hey, I'm really, really tired. I need to get, cooled off. And if you were to take a core temperature, it is elevated, but it would not usually be elevated above 104. Treatment, act quickly, get the person out of the hot environment as quickly as possible. Cool beverages, of course, non-alcoholic. Rest. There are a number of ways to cool the person off, depending on how serious the condition is. Maybe sitting in an air-conditioned room might suffice. And somebody who's got a severe case of this, they might require a cold water or ice water bath. And they should have been wearing lightweight clothing to begin with. That's more of a preventive thing. And up top it says, if the symptoms get worse or last longer than an hour, I would say if they last longer than an hour, the person probably needs to be sent to a hospital. Heat exhaustion can be serious, and the milder cases can be treated on site, but the more severe cases need to be treated at a hospital. Heat stroke is the one that kills people. I didn't mention, but heat exhaustion can progress to heat stroke. So when you think stroke, you think central nervous system problem. And heat stroke is not an actual stroke. There's no clot or anything like that, but it can look a little bit like a stroke. There can be a seizure, there can be confusion, there can be slurred speech. If you were to take a core temperature, it's above 104. Now, I say a core temperature. What they mean by a core temperature, and this is agreed upon by all the people who make these recommendations, a core temperature is a rectal temperature. So if you're not able to take a rectal temperature, then they recommend don't take a temperature. They don't think an oral temperature or a temperature of the ear is of any value because it's going to be inaccurate. Sweating may vary. I point that out because it used to be told that, oh yeah, with heat stroke, they're dry, they don't have any sweating. Well, that's not true. They usually do have some sweating, but they may have sweat an awful lot already and are not sweating as much at this point, but they generally are sweating. There is a condition called classic heat stroke, which usually occurs in elderly people with medical issues, and that happens when somebody's in an apartment without any air conditioning, they're not doing any exercise, and they can get heat stroke just because their body is unable to deal with the heat from the environment. And in those cases, because of medications and other things, there is oftentimes very minimal sweating. So treatment of heat stroke, here's the picture of the person in the ice water bath. You can see right up to the armpits. You got to make sure the person's head is out of the water. They may not be completely, coherent. It seems like a rough thing to do to somebody, but this is actually a life-saving measure. And it's the quickest way to cool someone down. And I have this highlighted down on the bottom here. The risk of severe illness or death are directly related to the duration of core temperature elevation. So you got to bring it down quickly. Now, if you recognize somebody as having heat stroke, you need to call 911. Do that right away. Get somebody on the way. But it's unlikely that they're going to be right next door. It's going to take a little time. So as soon as you get that call in, start the cooling process in whatever way you can. If you don't have something like this, spraying them with water might be a start, but do something. Be a good idea to have one of these basins available. This thing that she's looking at is called a thermistor, and it's actually just reads out constantly what the temperature is, which is good. Usually they want you to come down to about 101, but hopefully you're not the one who's doing that part of the treatment. So heat exhaustion versus heat stroke, they can look similar with the important difference that heat stroke has this neurologic aspect, confusion, unconscious, slurred speech. Dizziness can occur in both of these sides of things, but so just be aware of any sign of this that looks like heat stroke. I would suggest that if there's any question, you sort of treat it as heat stroke. In this case, you call 911 and then start cooling them off immediately. If you're confident that their level of consciousness is good and they're able to converse and they don't seem like they're having any neurologic symptoms, more likely to be heat exhaustion, you don't necessarily have to send them to the hospital right away. You can move them to a cooler area, loosen the clothing, have them start drinking water, or preferably a electrolyte solution. And again, cool them off with, depending on how severe it appears, you can go with spraying them with water, fans, putting them in an air-conditioned room, or, if necessary, a severe case of heat exhaustion, you can use the ice water bath. So which can you treat on site? Well, the heat cramps, certainly. Most cases of the heat syncope, unless somebody gets hurt when they fall. Mild cases of heat exhaustion. You should know within about 15 minutes whether or not somebody's doing okay. If they're sitting there drinking fluids and looks like they're able to do that, that's a good sign. I certainly wouldn't keep anybody there more than an hour if you're not sure if it's anything more serious than that. And then send to the hospital. Any sign of heat stroke, they have to go to the hospital. Anything that looks like altered mental status, sometimes changing personality or aggressiveness, something that's just out of line with what this person usually is, they need to go. Moderate to severe cases of heat exhaustion that don't get better very quickly, send them to the hospital. And remember to start the cooling immediately while you're waiting for the ambulance. So the risk factors, I didn't include the clothing, which is important, and PPE. I think Anna is going to discuss that next. The physical condition of the person, the military has looked at this and found that, someone who's not in good physical condition is more likely to get heat illness. Same with the elderly, more likely to get heat illness. Many medical conditions can make it more likely, including diabetes, kidney disease, cardiovascular disease, many medical conditions. Medications and drugs, again, there's a lot of them, but I would be concerned about diuretics. They're dehydrating, antihistamines that people use for allergies. Alcohol is bad in the hot weather for sure. Stimulants, whether they're prescribed or not, are not good for in the heat. It's not. It affects your ability to respond to the heat. environmental factors, actually the actual temperature, the humidity, the wind, and all that. I think Anna is going to discuss that. And acclimatization was mentioned. Again, Anna will go into that in more detail, but that's, usually takes about 14 days for somebody to be fully acclimatized from if they're just starting out in a new position. So keep that in mind. And I will turn it over to Anna at this point.
Thank you, Dr. Quinn. Up next is Anna Meyerhoff of NYCAMH. She is the Senior Bilingual Agriculture Safety and Educational Coordinator. She has delivered countless hours of on-farm safety training and outreach, developed curricula and written materials, and been involved with farm safety research. She received a BA in Spanish from SUNY Geneseo, grew up on her family's dairy farm, and has lived and studied abroad in Central America. In 2021, she received the Award for Safety and Health Researcher Award from the Agricultural Safety and Health Council of America. So we're so lucky to have Anna here today. Thank you.
All right, can everybody see my slides?
Looks good, and we hear you too.
All right, perfect. So this picture I like just because it has cows in it. Wherever the cows are is usually very well regulated temperature-wise. Get under the mister fans on a day like today. But I want to give a shout out to something that Rich talked a little about, which is the workplace culture and how supervisors and employers can manage heat. So this is a hierarchy of controls, and it goes from most effective all the way down to maybe effective, but you're relying on people. So we know we can't eliminate heat, we can't really substitute or swap out, but what you can do is change the way people work, and that's going to be a little more effective than relying on individuals to protect themselves and to have good habits. So it is really something that we can manage in the workplace. So things that employers can do, and some are already really great about this, figure out when the work can get done, when it will be cooler. So starting earlier in the day, switching up the shift so there's a longer midday break, maybe where people aren't under the midday sun. Most of the cases of heat illness are going to be between noon and 6 p.m. So if there is any way of changing, I mean, it's 85 degrees and humid here. My dad would have us out picking rocks. But if you can reduce those strenuous activities or switch the conditions where people are working, that's really effective. Having people slow down and take more breaks will actually make them more productive. And this has been shown in studies where they've compared groups with a normal schedule and groups that were given more frequent rest breaks to cool down. It really is effective. If you look at athletes, they're not constantly at a high level of activity. They do have a schedule in their training where they do cool off. So giving people a chance to have water, rest, and shade will keep them going, and they'll feel better and they'll do better the following day as well. Acclimatization, Rich started to mention, most of the fatalities unfortunately happen on a worker's first day or during their first week of work. So we really do need to get people used to the heat. So right at the beginning of the season, if you think of H2A workers, you don't really think arriving right on time and easing into the schedule. Usually you're full on harvest and you got to get people out into the field, but there are some things you can do to manage what their potential risk is. So there's a CDC website that is linked below. For new workers, you basically just take the first 5 days and you slowly increase their exposure. So workers who have been on the job previously, that's going to look a little bit different. They can take a little bit more, but you do want to watch them for the first week the most closely, and then up to 14 days at the beginning of their season. So acclimatization is most important for brand new workers who may have never been in the field. It's their first season, but also anybody who has taken a break from work for a week or more, they have to kind of get back into it. And also the most dangerous times, it's not necessarily in August. A lot of heat illness can occur right when temperatures rise at the beginning of spring or summer, and also when we all of a sudden have shifts in the weather. So a lot of heat illness can occur actually in July and earlier in the spring. So when workers are fully acclimated to the work conditions. They're going to sweat more, they're going to have more evaporative cooling. Their sweat is going to have less salt loss, so they're not losing as many electrolytes and they're less at risk for those cramps. They are slightly more at risk for dehydration, but they're going to be more efficient at cooling themselves and they're going to be less at risk for heat illness. So there is an advantage there. You're protecting people at the beginning of the season, and it's going to mean they're more effective and more productive. So if anybody has already had me out to the farm, I have been talking about heat illness signs and symptoms. I've been making sure to go over this with any workers that are doing pesticide training, workers who wear respirators, but you really do want to do something to make sure everyone is talked to about signs of heat illness and that they're looking out for each other. If there are those hot, humid days, you can provide additional breaks, change the schedule, do things like that so that people are able to cool back down. And buddy system is great. A lot of times heat illness can happen and somebody's by themselves and may start to have symptoms and no one catches it until they become more severe. And the day before I went off to college, actually, my older brother had heat stroke. That was a very exciting medical emergency. He had been working alone, so any of those mild symptoms were missed, and it was at the end of the workday. So came in for dinner and it was not good. So if someone's having symptoms, I do talk to workers about this. If they're mild, water, rest, shade, stay with them. But if somebody has severe life-threatening illness, they need to have that reported to a supervisor. They need emergency medical attention. So sometimes there have been fatalities due to a worker being left alone. That should be avoided. Have someone stay with them. Let's talk about hydration. And this is important even when workers might not be feeling thirsty, having that, getting plenty of water in you, about half a liter every half an hour. Some workers like Monster or Mountain Dew, and that will not really help hydrate. So anytime people are having alcohol after work or start the day with caffeine or have beverages with a lot of sugar, but there are some ways to replace the electrolytes. So having a salty snack, having salty peanuts or chips or something like that. Sports drinks watered down can be effective. They do contain a lot of sugar. Switchel or Haymaker's Punch, that's a thing more in the United States, and Suero or an electrolyte solution is another way of cooling down. So when I do worker training, I share a recipe. It's just water, a little salt, and a little sugar, and that will help hydrate a little better than plain water. Having people wear lightweight, loose-fitting, light-colored clothing so that they're more visible around equipment, but also to work in the sun. Having shade with a wide-brimmed hat, being able to add or remove layers, because sometimes, especially into harvest season, it can be pretty cold in the morning, and then once you get moving, you warm up. And then also thinking about who your workers are. We have a lot of tough guys in agriculture. Men are at a higher risk of fatal heat illness, and you can have your workers look out for each other. Create that culture where it's okay to say, you know what, I am starting to have symptoms, I need a break. Make sure that your supervisors are encouraging that, because there's a lot of pressure. We have a lot of work that needs to get done. Fruit needs to be harvested and vegetables in a certain window. But thinking about treating yourself like an athlete. I talk about soccer players and how they care for their bodies, and also considering the long-term health effects and outcomes that can happen. So really take care of your workers, make sure that they're well informed about the risk. And if anybody is wearing protective equipment, keep a close eye on them. There's some protective equipment like respirators and Tyvek suits where you are in a steamer bag, you're very sweaty, you're very overheated and at risk compared to someone who's not wearing that type of clothing. So just some factors to consider. Basically, it all boils down to communicating and keeping an eye on people and encouraging them to have water, rest, and shade. So the next thing I want to share is a bunch of resources, and some of them have already been mentioned. The NYCAMH OSHA Heat Tool app. It's a really great resource. I encourage people to download that, put it on their phone, and it's going to give you a better picture so you can measure those conditions and see when people are more at risk. There's also the OSHA Water Rest Shade campaign. So Nick had mentioned this has been around, and there are some really great print materials and training resources for employers to use. And this is just some of their heat illness prevention website. There's different sections that you can look at. It is a really good resource to check out. The Western Center is one of our sister centers, and they do worker safety training on heat illness. You can get them to send you materials for free. The bottom images of little foldy cards that fold up like an accordion. They have information in English and Spanish, some videos, and there's a whole training guide talking about hydration and heat illness prevention. Cal OSHA has some really great resources. They have a poster, fact sheets, flip chart, and training resources for supervisors to use. And they'll send you materials also. The National Weather Service, if you're really into weather, this is the heat risk website, and it'll help you identify when you're going to be at a higher risk for heat-related illness. CDC also has heat risk, and this you look up by zip code and it can give you information about how high of a risk you're at. The last one I will share, I believe, is the National Center for Farm Worker Health. They have some fact sheets. There's one about hydration and some culturally appropriate ways that you can hydrate with fruits and vegetables, coconut water, things like that. There's also a urine chart to see if you need to be drinking more water than you are, and those are available in English and Spanish. There's also a calculator on the OSHA website for protective equipment and clothing adjustment factors, so you can see, well, what is the heat index, and then are people also wearing these other things that we need to then consider whether they're more at risk for heat stress, and that link is below. And the Pacific Northwest Ag Safety and Health Center, that's another sister center of NYCAMH, has some resources for treatment, risk factors. They have a lot of great materials on their website as well. So all the resources I recommend are English, Spanish, easy to read, image-based, and a worker or a supervisor could use them to train others. So when you get a group of workers coming in, talk to them right at the beginning of the season when they're at the highest risk. We also collaborate on a YouTube channel with all the U.S. Ag Safety and Health Centers, and there are some heat illness videos in English and Spanish showing things like dehydration and cramps and just what is heat illness and what mild and severe heat illness looks like. So all of those resources, you've got QR codes and links to that. And this is where I wrap up and see if anybody has questions. So this is something that's doable. You can train your workers and communicate with them. You can set up a safer system where people are taking care of each other, and you schedule in those breaks or change the schedule so that it's easier for people to stay safe. Thank you, everyone.
Thanks, Anna. There's very good information. Before we go over to questions, I just wanted to take the opportunity to thank NYCAMH and Cornell Workforce Development for hosting this webinar with us today with all this great information and resources for farmers and farm workers alike. You will see in the chat there are a number of links to the resources, and we will be sure to share those as well. So if folks have questions, please put them in the chat function, and I will be happy to go through them. I think the first question we had was regarding the PDF of the water rush shade poster, and that is available on the OSHA website. Go to publications and from the link above. So we have a question regarding going slower and how rest breaks and going slower can be more productive than just going full bore like you normally do in times of heat. Would somebody like to take that?
Sure. And if Dr. Quinn or anyone else wants to speak, go for it. Basically, scheduling in those breaks and working at a slower pace, especially at the beginning of the season, your body is going to be able to respond to getting overheated and be able to cool itself effectively. So having more water breaks to rehydrate so you can continue to sweat and cool yourself effectively. Once you get to full throttle working really quickly, it's going to be much harder to cool back down once you begin to get overheated. And one study in particular in Nicaragua, they compared cane harvesters who are out there in the cane fields with a machete, very physically demanding, very warm. They compared workers who got basically a 15-minute break every hour, and then the workers with a normal schedule. At the end of the day, who was more productive? It was the workers who rested more frequently because they were able to work longer at an effective level. So being able to cool yourself down, being able to rehydrate so you can continue to sweat and cool yourself is the goal.
Great explanation. Thank you. I don't see any more questions in the chat, but I'll give it a minute here. Yes, we will share the recording out. Easy question I can take.
While we're waiting, I will give a NYCAMH plug. So if you haven't already had me out to your farm, I do guest worker trainings on worker protection standard, food safety, gaps, all of that. And I also do talk about heat illness. We also do free first aid and CPR trainings, and the American Heart Association certification also includes heat illness prevention and treatment. So if it's not a severe, call 911. What are the things you can do to cool someone if they do have a medical situation? So I do basic classes that are about an hour, and then the full certification, and all of it's free for farms in New York.
Thank you so much for that plug.
And while we're waiting, I'll also say that that OSHA heat standard that I think Nick mentioned that at the beginning, there will be a comment period coming up. And Nick, has it appeared in the Federal Register just yet?
I don't believe so. Right, Richard. When it is published in the Federal Register, then it is open for a 120-day public comment. So yeah, be on the lookout. As of today, I had not seen it published in the Federal Register, but there will be a extended public comment period, and I think they're even planning some public meetings. So yes, there'll be opportunity to comment on the draft proposal.
And of course, it is important to put those comments in there and to help the agency understand the unique needs of an industry like agriculture.
Absolutely. Thank you. And to Christina Day's point too, the John May Safety Fund can also help fund heat-related safety upgrades. So check them out as well. So since I'm seeing no more questions in the chat, we will close it out. Thank you again for all of our presenters today and for all of you for taking time out of your busy schedules to learn more about this topic. It's very, very important and on front of mind. So thank you very much and have a wonderful day, everyone. Take care.
Thanks.